Hi, good afternoon. My name is Finesse Muya, and today we'll be doing the syringe and vial technique. So first, what you want to do is gather all your materials necessary for this procedure. Then you will go ahead and sanitize your hand prior to beginning the procedure. You will select and sanitize an appropriate injection site, preferably the stomach or abdomen or somewhere with fat. One swipe. Then you're gonna go ahead and inspect insulin. So right here we have our insulin. You're gonna inspect the insulin and verify that there are no visible signs of degradation. If insulin is kept refrigerated, vial should be warmed by rolling it between your arms. Then you're gonna make sure, check the expiration date of the insulin and cleanse the rubber stopper with alcohol. You're gonna inject appropriate amount of air into the NPH vial first. So we are going to open this up. Open. And open. You're gonna go ahead and inject the appropriate amount of air. Then you're gonna inject the appropriate amount of, then you're gonna turn your vial and syringe upside down, just like this. Then you will hold the vial with one hand and withdraw appropriate amount of insulin. In this scenario, I am going to draw 30. You're going to use appropriate technique to correctly remove any air bubbles. Just like this. You're going to withdraw appropriate amount of NPH by pulling back syringe plunger to the total amount dosed. When you're performing a self-injection, please make sure you go ahead and discard 25 units into the sharps container before proceeding on. Pinch up an area of the skin at the injection site, such like this, and push needle all the way in at a 90-degree angle. Pushes plunger all the way down, making sure the insulin has fully gotten into the spot. Pull needle straight out, then release the pinched skin. Do not massage the skin at the injection site. If injection bleeds, use tissue to clean the site up. Safely discard. Use needle and syringe into your sharps container. If the area is bleeding, just go ahead and open up a bandage and put it onto the skin. Make sure your area is clean and that everything has been disregarded properly.
Hello, my name is Dominica McCarty. I'm a pharmacist intern. Today I want to show you how to use your Humira pen. You want to first start off by making sure your area is clean, as well as clean and sanitize your hands before beginning. You want to make sure you gather all your supplies, your pen, your alcohol swab, your Band-Aid or cotton swab just in case, and a sharps container. You're going to use a subcutaneous route of entry today, and that's going to be right under the skin. Choose a fatty area, either in your abdomen, away from your belly button, or into your thigh. You want to ensure that your pen has been sitting out for at least about 15 or 30 minutes to make it a bit more comfortable for you. We're going to roll our pen to ensure that our medication is mixed and well ready to be dispensed. There is a window on the side to where you can see the medication. You want to also ensure that that is clear. You do not want a cloudy medication at all. That would not be something to use. With your injection site, you want to go ahead and make sure that it's wiped clean, and you want to let that dry before dispensing. On your pen, there is 2 caps, a 1 and a 2, 1 where your medication will be dispensed and 2 where your trigger would be exposed. You want to go ahead and remove your caps. Place your pen firmly against your skin. Press down, make sure your plastic is not being able to be seen. That way, when you press your trigger, it will be ready to go. You will hear a loud click. You will be able to look in the display window, and once that indication is clear through and you will see a yellow indicator, then you know that your medication has been properly dispensed. You will remove it away from your skin and dispose of it into your sharps container. Thank you.
I'm Christian Salas. I'm a pharmacist intern, and today you will learn how to properly check your blood glucose levels. So you start off by sanitizing your hands. And now you grab your lancet device. You open the top to reveal the inside components, and you would insert your lancet. And now you will also take off the top of your lancet to reveal the small needle. Now you may place the top. Okay. So now, while using your lancet device, you may notice that there is a dial which you can move around. So this is for the depth to prick your skin with, how far the needle goes down. And then now, if I pull this tab back, you would hear it click, for example. You will hear it click, and that means it is ready to be used. So in the case that you would hear the click, you would prick yourself. You'd prick the skin, and you would reveal blood, and then when blood is revealed, you would pinch your skin. That way more blood comes out, because you need an adequate level amount of blood to check your blood glucose. So you would put the test strip against your blood. That way it can be absorbed by the machine. So in this case, you would see either 2 numbers or 3 numbers depending on the blood glucose level of your skin. Hyperglycemia is above 180, and hypoglycemia is below 80. Thank you.